Welcome back to another episode of Hallis City Podcast. Today we're talking about a subject that's very close to people's hearts, eating disorders, a very stressful subject, and lots of people suffer in silence. And today I'm very lucky to have Cindy with me. Hi Cindy, nice to meet you.
Lovely to meet you, Aaron.
So tell us a bit about yourself, Cindy.
So I'm a clinical psychologist with 13 years experience, and I was trained in Australia and I worked there for over a decade. I've recently moved to Dubai. And before my current role at Mediclinic Dubai Mall, I was leading a multidisciplinary team that was providing outpatient treatment to adults with eating disorders. And that's a client population I'm really passionate about working with.
Well, Australia's loss, our gain. Really happy to have you here. And working at Dubai Mall is a beautiful facility, and I often come to visit and see it. So eating disorders, what sort of type of eating disorders do people suffer from them, and what is the sort of signs and symptoms that people should look out for?
So eating disorders are serious mental illnesses, and they're characterized by disturbances around thoughts, feelings, behaviors related to body shape, body weight, food, eating, or a combination of those factors. And when we think about eating disorders, I think anorexia nervosa and being in a very thin body tends to spring to mind. But actually binge eating disorder and bulimia nervosa are more prevalent. So I'll start with those eating disorders. So binge eating disorder and bulimia nervosa is characterized by recurrent episodes of binge eating where someone will eat a large amount of food in a discrete period of time. And they'll experience a sense of loss of control in that they want to stop, but they don't feel that they can. And often these episodes are accompanied by feelings of shame and disgust. So they do tend to occur in secret. And I guess the thing that kind of distinguishes bulimia nervosa from binge eating disorder is that in bulimia nervosa, people will also engage in compensatory behaviors. So things like self-induced vomiting or misusing laxatives or over-exercising. So as I was saying before, often when we think about eating disorders, we think about anorexia nervosa, we think about people being quite emaciated, but often people with bulimia and binge eating disorder will be in a body, will have a BMI between 20-25, or they'll be in a bigger body. So you actually can't tell if someone has an eating disorder just based on their weight.
How do you think society and sort of culture adds pressure to people's eating disorder? I mean, do you think that is a factor?
That absolutely is a factor. I mean, kind of in combination with other factors such as biological, genetic, and psychological factors, the social and cultural pressures, I think, interacting with those other factors can absolutely increase someone's vulnerability to developing an eating disorder.
When you say psychological factors, what do you mean? How does that increase the sort of vulnerability to someone for an eating disorder?
Sure. So some psychological factors, let's see, one would be perfectionistic traits. So if somebody has quite unrelenting standards that they apply to many areas of their life, and they're quite black and white about how they interpret success or failure, and they apply that way of thinking about things to, say, dieting or controlling their body shape or weight, then they're going to be more vulnerable to dieting, to engaging in pretty extreme behaviors to control their shape and weight. And someone who isn't perfectionistic might go on an extreme diet for a few days and just kind of be like, well, I don't like being hungry, or this is boring, and then just go back to what they were doing before. Whereas someone who has perfectionistic traits is more likely to continue with those behaviors and then be more vulnerable to developing an eating disorder.
I think now society with social media, there is a huge pressure on people to always look fantastic, always look the best. And I think it is a big pressure. But do you notice there is an increase in men or women, or is this something across the platform that's affecting both genders?
Oh, absolutely affecting both genders. And I think we're recognizing more and more that males absolutely experience eating disorders as well. And I think, there's more. I think there are more males coming forward seeking treatment than there have been in the past. And you also mentioned, this idealization of like thinness ideal. And that's one of the, I think, social or cultural factors that can increase vulnerability to developing an eating disorder. Because, we're all bombarded by these messages that, losing weight, we equate that to being healthy. There's a certain aesthetic that we see in lots of ads and things. So if an individual internalizes that message, they're going to be more likely to engage in disordered eating and therefore develop an eating disorder.
If one of your patients, if people don't get help, what is the long health sort of side effects someone's likely to suffer from if they don't seek the appropriate help needed?
Eating disorders, it's a serious mental illness with pretty devastating physical health consequences and can actually also be life-threatening. And in fact, anorexia nervosa has the highest mortality rate of any psychiatric disorder. And some of the physical health impacts can include poor heart health. So if you're losing weight rapidly, what happens then is muscle wastage. Your heart is a muscle, so then the heart shrinks, it becomes weaker, and then the person might experience getting tired really quickly, feeling faint, irregular or slowed heart rate, in some cases death or a heart attack, and that poor heart health can also be because if someone is misusing laxatives or vomiting quite frequently, then that leads to fluid loss, which then impacts electrolytes, and electrolytes are really needed to keep muscles going properly. So that's another way in which heart health can be impacted by eating disorders. Other things include poor bone health is another health factor to take into account. So if somebody is not quite laying down they're not getting their optimal bone density throughout adolescence, then that means that they're going to be more likely to develop osteoporosis later in life. And that means bones being more fragile, being more likely to break.
This sounds to me like make sure they come to see you if they're starting to have some signs and symptoms. I think probably a big worrying thing is, so you book an appointment to see you. How does a patient start to go into their treatment? So you identify there's a problem. What is the sort of treatment methods you'll be offering? Or is this from medication, or is it around psychological treatment? Is it a mixed bag of everything?
Regardless of the psychological treatment approach, in an ideal world, someone with an eating disorder will have a team of clinicians around them. So ideally, there would be a psychologist on board, a medical practitioner to be doing the regular medical monitoring, involvement of psychiatry, dietetics, sometimes endocrinologist can also be really helpful. So regardless of the approach, often having that team approach is really kind of the gold standard. And in terms of the psychological treatment approaches, so there are a couple, so I'll go through maybe two or three. So one is enhanced cognitive behavior therapy, or CBTE. So that's a really active, pretty structured kind of treatment approach that addresses key features in anorexia, bulimia, binge eating disorder, and other specified feeding and eating disorders. So it's transdiagnostic. And that treatment involves developing a shared understanding of what is keeping the person's eating disorder going, after which the initial stages are around re-establishing regular, adequate meals and snacks. If the person's underweight, then assisting them in starting to get out of starvation, after which you might address factors like dietary restraint or being able to cope with challenging emotions and stressors more effectively, perhaps core low self-esteem. So it is a pretty active kind of treatment. Another treatment approach is specialist supportive clinical management, or SSCM. So this treatment is specifically for people with anorexia, and it kind of comprises of two parts. The first is clinical management, which is about helping the person reestablish regular, adequate meals and slowly restoring weight, or gradually restoring weight. And the second part, the supportive psychotherapy, is very client-driven, and it's really about addressing whatever the person brings to the table that day or for the next few weeks, and it may or may not be directly related to the eating disorder. So that part is kind of a bit more free-flowing than you would see in that first treatment approach I spoke about.
So as a clinician, what is the sort of challenges you face with once a patient is diagnosed?
So I think one of the main challenges is that eating disorders are often experienced as egosyntonic. And so that means that the person will experience the eating disorder as really being entwined in their sense of self. And it's just really a part of them, not something to be rid of, and they mightn't even think of it as being possible. So the way that a supervisor sort of explained that idea to me early on in my career is that an equivalent would be if someone came up to me and said, Cindy, it's wrong that you're a woman. I know it feels right, but there are all these ways that it's harmful to you. So let's work together on you not being a woman. So if you're working with someone who experiences their eating disorder, really egosyntonic, then it's super important to take the time to really understand how the eating disorder works for them, what powerful functions it's playing in the person's life, really understand what is keeping that eating disorder going for the person, and really laying that foundation before you then invite them to think about the costs of the eating disorder, to think about in 5-10 years time, what would life with and without the eating disorder look like, and kind of weaving the motivational enhancement throughout assessment and treatment to support the person in being able to identify and then hold on to their reasons for change. So that, the dealing with the egosyntonic nature of the illness, I think, is really tough. And I think another challenging aspect of working with people with eating disorders is, as I mentioned before, it's so, it's a serious mental illness. There are potential pretty devastating physical health consequences. So it's important to think about when you're setting up treatment, setting it up in such a way that the person's safety is really being accounted for as much as possible. An example of that might be to have an agreement that the person sees their medical practitioner at least fortnightly to make sure that they're medically stable. And if they're not, that's being addressed sooner rather than later.
Okay, so tailoring the sort of management plan around that particular person. How does family and friends play a key role in someone's treatment?
I think family and friends are really key to someone's recovery journey. And some things that family and friends can kind of keep in mind is, to best support their loved one with an eating disorder, are to, educate themselves, read about eating disorders from reputable sources so they understand what's going on for their loved one. I also recommend listening to podcasts and reading books by people with lived experience. That provides a really important perspective as well and can help foster empathy and compassion. Another is to separate the person from the eating disorder. So there's the person, there's their eating disorder. They are not one and the same. And, an example would be, say, if someone didn't have their lunch and they throw it out, but they tell their partner that they ate it, and the partner knows that they did throw it out and they weren't being truthful. So something that could be really helpful for the partner is to remember that their loved one isn't being sneaky or manipulative. It's just that eating disorders thrive in secrecy. And so, this behavior is about the eating disorder trying to fight for survival. And, I think another advantage of trying to separate the person from the eating disorder, or what we call externalizing, is that when the person is ready to actively engage in treatment, then that way of thinking about the eating disorder means that their loved ones can be aligned with the person fighting the eating disorder, which is the problem, not the person.
So people who are worried at home, who think they may have an eating disorder, or they're just not sure, or they just want to seek some guidance and help, what's your take-home message to them as a psychologist? I
think definitely reach out, speak to their GP, speak to their medical practitioner, express their concerns, and ask about engaging with a psychologist or engaging with a psychiatrist, just to kind of have a bit more of an assessment to understand the nature of the person's eating challenges and what the next steps can be for their care moving forward. If the person is isn't quite ready to engage in treatment, but the people around them are really concerned, then, if they come along to the appointment with the GP or the medical practitioner as well, if they speak to the person and express their concerns, not to be pushy, but to kind of say out loud, hey, I'm worried about you. I'm here for you whenever you're ready to talk, or if you would like my support the next time you go to like the appointment with your GP. So, you know, there's absolutely ways to kind of reach out and take that next step.
Thank you so much, Cindy. It's been really nice to meet you. And today's podcast has been really interesting, and it's really brought us some really key facts, and I think a lot of people who worry out there.
Thanks, Sarah.
That brings us to the end of our podcast today, but I just want you to know, if you are feeling like you have an eating disorder, or you are feeling any symptoms at all, or worried about a loved one, then book in with Cindy and the team at Dubai Mall. They're here for you all the time. And I know it must be a worrying time. Thank you so much for listening at Hala City Podcast. Thank you.